President Trump speaking with victims of Obamacare at the White House yesterday, who may continue to suffer if a new bill is not passed.
Marjorie and Kevin Weer from South Carolina have a son, Monty, who suffers from spina bifida. Washington Democrats promised families like the Weers that if they liked their doctor, they could keep their doctor. But now there is only one insurer left in the state exchange. More Obamacare lies.
The president cited the Weer family. They are basically a family from Mount Pleasant, South Carolina. Marjorie Weer is the mother of 3-year-old Monty. He's had spina bifida. He is basically not getting the care he needs under Obamacare. Marjorie, thanks for coming on the show. We are so sorry what is going on with your son. Can you tell us a little bit about your experience under Obamacare?
Absolutely. One of the keys to giving a special needs child the care that they need is continuity of care. And with Montgomery, he has been on 3 different insurance plans with 2 different carriers, and he's only 3 years old. Every year, I have to wonder which doctor are we going to be able to see this year. Is it going to be the doctor that my husband and I have chosen after many long hours of research, finding the best for our child? What's going to happen next year? So the uncertainty of Obamacare, how it's going to affect access to health care, is one more frustrating piece to this whole puzzle.
Yeah, Monty was born in 2014 after Obamacare was passed, and it promised families that if you liked your doctor, you could keep your doctor. That turned out not to be true for your family. Is that right?
That's right. Not only that, but this year our premiums went up 23%. Our income did not go up 23%, but our premiums went up 23%, and the access to health care got smaller. I think sometimes people confuse access to health insurance with access to health care. My son can't be denied insurance, but he doesn't have all the access to health care that especially we feel that he needs. So it's two totally different things that sometimes people equate, but it's not the same.
That's such an important point you're making. I think, correct me if I'm wrong, there's only one insurer left I think in the exchange in your state, and it does not cover out-of-state care. You have to fly to Boston. Is that what's going on?
Well, in order for them to stay viable in the state, which I do want them to still stay in the state, it's my understanding that they had to basically restrict care to just in state. So I had to work for 6 months to negotiate with them, and they were very kind to work with me. But I had to spend 6 months away from both my children, who are under the age of 3, to negotiate with them to get my child up to Boston Children's Hospital, where my husband and I felt that was the best care for him. So it was a long process. They did work with me, and I'm very grateful for that, but it shouldn't be this complicated.
Marjorie, if you could have a message sent to the senators now debating Obamacare reform, what would the message be?
Well, so far you've been working really hard at earning that 16% job approval rating. You were sent to D.C. not to go to cocktail parties or to get your committee chairmanships. You were sent there to work for the people with very specific mandates: repeal and replace Obamacare and cut our taxes. It's that simple. You are to get up, go to work, focus on that until the job is done. I'm glad that they finally voted to start the process, that we didn't have to flip the calendar page to August before they decided to stop talking about taking a vote to talk about repealing Obamacare. So I am grateful for that, but get your job done or we'll sit home in 2018.
That is a message that likely will ring loud and clear, what you just said. What was it like being invited with 3 other families to stand behind President Trump yesterday for his remarks at the White House pressuring lawmakers to act?
It was such an honor to be there with him. I joke that my job as a special needs mom is to annoy people and constantly go over people's heads until I get what I need. And there were a whole bunch of families there who made it all the way up to the White House. So it was such an honor to have the ear of Secretary Price with the Vice President, with the President, for them to hear our story, because our story of how people are negatively affected with the ACA, that's not always heard because it doesn't really fit a narrative. And so to have our stories told and to be validated that we are hurting, this hasn't turned out to be the godsend to the insurance world and healthcare as it was promised. To be able to be there and to look them in the eye and say, what do we have to do to spur these people on to do their jobs? It was fabulous. Everybody was so kind. They were so kind and generous to us. So thank you, President Trump, for inviting all of us up there.
Marjorie, has any Democrat reached out to you to hear your story?
So far, no, but I'm willing to talk to anybody. We don't have to agree 100% on every issue to work together. We can find common ground. I know that's sometimes an overused phrase in D.C., but I will work with Democrat, Republican to find the best answer for as many Americans and their health care needs, because it's so diverse. Even in my own family, what a health care plan my husband would need is going to be different from what my son would need. I will talk to anybody. I will work with anybody to try to find the best possible solutions for this crisis that we're facing. And I don't think that many in D.C. see it as a crisis. If they got out of the Beltway and came and talked to us, maybe they might see it as the crisis, but I'm willing to talk to anybody. And let's work together. Let's find solutions.
Marjorie, what would you say to the Republicans who voted against even debating Obamacare reform?
I think you just made your opponents, their media to go against you if they were to primary you. Why do you have an R beside your name? I mean, they're free to do what they want, and I understand if maybe their constituents, if they are representing their constituents and that's what their constituents wanted, I have to respect that. I don't know if that's true or not, but you're not helping a lot of Americans with that vote.
Marjorie, we are so sorry for what you and your family is going through. Monty looks like a wonderful child, and we're here to hear you. We want you to come back on the show again to talk more about what it's been like to get health coverage and care for your beautiful son there. Thanks again for coming on, Marjorie. We appreciate you and your story.